Cancer is a leading cause of death among children and adolescents worldwide. More than 400,000 children are diagnosed with cancer each year. And unlike cancer in adults, most childhood cancers do not have a known cause. In Iran, over 3,500 children are diagnosed with cancer annually. Leukemia, brain and central nervous system tumors, lymphoma, and bone cancer are the most common. 1 in every 2 children diagnosed with cancer in Iran will not survive. This is due to lack of available cancer treatment centers, lack of access to these centers, patients' families' lack of acceptance to choose the treatment course, and unaffordability of cancer diagnostic and treatment services.
Responding to this problem, we considered a comprehensive program named National Cancer Control Program. Based on this program, we have a component as Iran National Cancer Care Network for developing infrastructure for cancer patients. We evaluated the current situation, 27 chemotherapy centers in 24 provinces in our country, and 7 provinces have not any services for childhood cancer. Regarding bone marrow transplantation, there are 5 bone marrow transplant centers in our country, and most of the patients, childhood cancer patients, should refer to just these 5 centers. 70% of cancer treatment and services in outpatient level paid by insurance companies, and 90% in inpatient level. But compensation of remaining sometimes is not easy for the families. So nearly 68% of families in Iran go under line of poverty when one of the family members diagnosed with cancer.
To strengthen cancer control programs around the world, the World Health Organization launched the Global Initiative for Childhood Cancer in 2018.
So the WHO has since 2018 is engaged on global level in a global initiative of childhood cancer together with other UN agencies. It's a very important initiative because it has identified childhood cancer as one of the problems, health problems in the world, in many countries, in most of the countries. And the initiative is trying to, first of all, to assess the situations in the various countries and to improve the early diagnosis, the treatment, the access to treatment, problems of financing the costs for the treatment, the social care aspects, particularly for childhood cancer. So the initiative aims in particular to level off the inequities which are there between the countries, between the rich countries, the poor countries, and the countries in between in terms of childhood cancer treatment and care and prevention. So this global initiative for childhood cancer is a very important one because it is at the heart of dealing with very young people and children.
The Ministry of Health and Medical Education has already adopted the initiative and works closely with WHO in line with the National Cancer Control Program.
In high-income countries, the likelihood a child will survive if that child is diagnosed with cancer is 80 or 90%. And this proves that in fact childhood cancer is curable for so many children. The Islamic Republic of Iran has shown a tremendous commitment to prevent and control non-communicable diseases, including cancer. And for us, childhood cancer is an important tracer in that agenda.
childhood cancer یا سرطان‌های کودکان در واقع به عنوان جزئی از برنامه ملی مدیریت سرطان پیش بینی شده و اقدامات خیلی متنوع و متعددی برای در واقع کاهش بار سرطان کودکان در حال انجام هست. یکی از این خدمتتون که عرض کنم کارهایی که بایستی برای نشنال کانسر کنترل پروگرام انجام بشه بحث در واقع پایش میانی یا میدترم ریویو این برنامه است که با همکاری سازمان جهانی بهداشت، آژانس بین‌المللی تحقیقات سرطان، آژانس بین‌المللی انرژی اتمی و وزارت بهداشت درمان و آموزش پزشکی در کشور در دست برنامه‌ریزی و اجراست که انشاءالله به زودی ما شاهد این میدترم ریویو خواهیم بود. گزارش‌های این پایش میان دوره‌ای در واقع به ما کمک خواهد کرد که گام‌های آینده رو درست‌تر و دقیق‌تر برداریم.
The country is also implementing several programs to help prevent cancer in adults and children by extension. The Iran Eco program was launched in 2015 with the goal to promote healthy diets, encourage physical activity, and help prevent obesity in a collaboration between WHO and the Health Ministry. In another national effort, the Tobacco-Free Initiative was implemented in September 2019 in the city of Qom and is expected to gradually expand to cover further areas of the country. Efforts have also been made to stop the use of tobacco and water pipes in restaurants and cafes. Iran has also established a comprehensive information management system to record, plan for, and improve all national cancer prevention programs. WHO is supporting the national cancer control programs through a number of activities, including facilitation of procuring cancer medicines for young patients due to the momentary shortage of supplies in the country.
So we had the problem in the last years that because of the unilateral sanctions, there were shortages reported in important cancer medicines for children. And it was also published in international journals, for example, The Lancet. And during that time, we were in contact with the ministry and some of the cancer treatment centers in Iran, in which way we can support and address that emergency situation with the supply. And fortunately, in this situation, we got an offer from the European Union, who has been willing to spend as a grant about 2 million euros to purchase and procure those cancer medicines for children most in need. And we had various rounds of discussion with the Iranian Food and Drug Administration to identify exactly the specifications. And we have a list about the 12 most needed medicines. They are now being procured. There are international global tenders to get the best offer. Most of them have already arrived in the country.
The procured medicines are planned to be distributed to 32 pediatric treatment centers across all 31 provinces of the country.
We are very glad that in such a situation there was a funding partner available with the European Union, and the project will finalize soon. Most of the medicines have arrived and the distribution will start soon.
So this cure-all approach is the way that we are able to bring the global community together, to set priorities, to use a shared language, to define the clear interventions that are effective, and to share those best practices and case studies across regions and across the world. So we all know the statistics behind cancer are very concerning. In fact, 1 out of 6 deaths, more than 1 out of 6 deaths, is due to cancer. This is a diagnosis that will impact all of us. So for a country like Iran, what we are able to do is to learn from what Iran has been able to do successfully and to also share what are other countries in the region and beyond doing in childhood cancer that may inform the policies and programs in that country. This domino effect is a very strong justification for why to start with childhood cancer, and again, we've seen the success in so many countries. So this is the short-term direction with the recognition for us to reach our target. Every country must be invested in some regard in childhood cancer, and we do think this is possible.